Hello everybody, reporting live from Centre Endodontic Saint Laurent in Montreal, Canada. This is Dr. Chafic Safi, your local endodontist, and maybe your international endodontist. Today we're gonna take a little roundabout in the clinic to show you and to showcase some stuff that we do in clinic, what we have as in terms of instruments, in terms of machines, what do we do in clinic, and then we have a couple of announcements at the end of the video, which will be the big highlight of today's video. So we are here now located in the waiting room of the clinic. When the patient comes in from the door right here, he checks in at the front desk with one of our front desk receptionists, who will be glad to take all the information of the patient, his medical history, fill out a chart, and all the required information to be able to receive the patient after that in my operatory room. While waiting in the waiting room, the patient gets to see some of the videos which could appear on the screen from time to time, explaining to him in general terms what is a root canal, why do you need it, and what are some of the steps that are required, just to kind of let the patient start to think what he or she will undergo as a treatment with me. Once the patient is called, we take him to the operatory room. So if you can follow me, and I will show you our operatory rooms in clinic. So the patient will walk through this corridor here, which will lead to a series of op rooms, and then we're going to go right away till the two last op rooms, which are equipped for root canal treatments. So on the way, as you can see, we will have a first stop, and the first stop is one of the highlights of the clinic, is what we use to diagnose and to treatment plan in some of the cases, and it's called the CBCT, or a CT scan, or in other words, it's a three-dimensional image that we take of the tooth itself. So not in all cases, but in some cases, we do require to have the patient undergo this kind of imaging technique in order for us to really have a better image and a better idea as to what is happening with the tooth, what is the problem, and most importantly, what is the required treatment plan for the patient. We'll go back to that beautiful technology in a couple of minutes or in some later videos, but this is really one of the biggest highlights in the clinic. As we continue, you can see that the theme of the clinic, the decoration, is airplanes and aviation. As most of you know it, I'm a big fan of the aviation industry. I follow the news of all the airliners, the airline companies, and I collect some of the models of airplanes, ranging from old ones such as the Concorde to the most recent one, for example, such as the 380. I tend to integrate sometimes a bit of dentistry in there. It's always good for the patient to feel that he is in a dental clinic and not in an airport. So as we continue, we're going to visit the first operating room, and each operating room in the clinic is well equipped with everything that an endodontist will need to be able to diagnose and treat any patient with any endodontic treatment, whether it be a root canal, a retreatment, an endodontic microsurgery, internal bleaching, dealing with a traumatic injury, or anything of that sort. Each room is equipped with a state-of-the-art dental microscope with camera, so that we could take a lot of videos and pictures to showcase the case for the patient and for the referring doctor. We have state-of-the-art technology that will let us do everything in one step if you want, or to decrease all the clutter that could be around the patient in terms of like cables and wires and stuff like that. Everything is integrated into one machine, which makes the experience of the patient much less cumbersome, less stressful, and more pleasant than having wires up and right and left and down and going all around his head. This is one of the operating room. The other operating room is also right here for endodontic treatment. We have a couple of differences in there. The microscope in here is much more, if you want, advanced. It's the latest of the family of the dental operating microscopes. It has an integrated camera with a live feed, which can let us directly communicate the images between us and the referring doctor, should there be something that requires to be shared on the spot. In each room, I also tend to integrate a bit of aviation. So in here, as you can see, we have a small picture of a very old airplane that describes a bit also on it what is the speed and the max speed of an airplane when it's compared to the speed of sound. So this is a bit the clinic. We offer general care, endodontic treatment, retreatment, and endodontic microsurgery, and everything that has to do really with the diseased tooth or the diseased pulp. And we are aimed at saving the tooth and more at saving the pulp inside the tooth. Now, as a big announcement for everybody, I know that a lot of you have already seen this video, this clinic. I mean, today we are very happy to announce the creation of a new way of communicating with each other, and this is a new YouTube channel that is called the Endo Doc. On this YouTube channel, we will have regular videos about a lot of important topics in endodontics. We will be sharing cases, clinical tips, techniques, what to do, what not to do, and these videos will be aimed at sharing and connecting everybody on the planet to be able all together to really learn from each other. They will be targeted to the patients, sometimes to the referring dentists, to other endodontists, and also to anybody who's really interested in learning about root canals, endodontics, and all this beautiful discipline that really aims at saving teeth and keeping the natural and beautiful smile. Again, the YouTube channel is called the Endo Doc. You could start subscribing on it and following it as soon as you hear this video, and I look forward to meeting all of you there, taking your questions, answering them, and sharing my knowledge and my passion for endodontics. So till the next flight, or rather the next video, I hope that you all be taking care of yourselves, and I hope to see you around in one of the endo meetings soon around the world. Thank you.